HR team, and today I'm going to be talking to my colleagues here about their roles within the hospice.
And my name's Lisa. I've worked at the hospice with the community team as a healthcare assistant now for coming up to 5 years.
Hi, I'm Martin Warwick. I've been at the hospice now for 16 years. I'm an assistant practitioner, but originally when I started at the hospice, I was healthcare assistant on the ward doing permanent nights, and I've basically sort of worked in all the different departments within the hospice, and the hospice have given me the development for my future, and that's where I'm at the minute.
Good afternoon, my name is Irene Clark. I am also an assistant practitioner, and I've been at the hospice now for nearly 16 years. I started originally as a night carer in a nursing home for 5 years when my children were really young. And then I got the opportunity to come here at the hospice to enhance my skills. So I worked on the ward and across all the clinical areas. And through that time, the hospice gave me the opportunity to start from a healthcare assistant and work myself way up to assistant practitioner, now working in the community.
Firstly, I guess what we want to know is, what does a day at St Nicholas Hospice Care look like?
A typical day in the community team will involve a morning meeting when we first get in. We find out who's in that day, and we have a list of tasks. So that might involve phone calls to patients, phone calls to relatives, and possible care visits to provide personal care or new referrals that have come in that need a first assessment. The trained staff will go through all the tasks and divide them up, and that's how we start our day. It's also, you never know what your day is going to be like. We're educating families with end of life care, with mouth care, things that they can do to feel that they've got a real role in caring for their loved one. We can be making phone calls to families, bereavement visits and bereavement calls, and working closely, like Irene has already said, with district nurses, doctors, hospice specialist nurses. So you really feel like you're learning every day and more about palliative care.
What is it you enjoy about working for a hospice rather than in any other sort of care setting, and St Nicholas Hospice in particular?
Thanks for that, Kirsty. I think the thing that I enjoy about working for the hospice is actually, obviously for my length of service, 16 years, it's not just a place of work. You actually get to see people you work with, but also they do become not just colleagues but friends, and it's a bit like an extended family, really. I don't mean to sound a bit mushy, but it is, because you do get to work together, and we all know how each other ticks to a certain degree, and because of, we know, like Irene and myself and Lisa, we do know quite a lot of people in the hospice, sorry, that actually it does give you that sense of grounding. And I think being able to give your all to that patient that time is just such an amazing thing to do, not just physically but also emotionally as well. And I think we haven't touched on as well that is also, we do care after death as well. That is such an amazing thing to do. It really is. So, and I can't stress that enough. But I just really enjoy working for the hospice. Like anywhere, we have our ups and we have our downs, but you know what? It's absolutely fine. It is. I still feel proud to work for a hospice, for the hospice, really, and I just think it's what palliative care is all about, rather than given the time, really.
What do you get from working as a care assistant? What does it bring to you?
I really love working here as a healthcare assistant. It's a very rewarding role because, as Martin said earlier, it feels a real privilege to to be there caring for someone at the end of their lives, and being able to support the families and friends. It's not just about the patient, it's about everyone as a whole. And I just find it a very rewarding job.
Does anyone want to talk to me about, any development that they've done during their time with the hospice and how the hospice has supported them?
Yeah, since I've been at the hospice, we have mandatory training yearly that's really, really helpful. But I've been on many courses that the hospice has provided for end-of-life care and difficult conversations, which have been amazing to attend. They really have helped with talking to relatives and patients, and just with my job in general. I've also had training in doing first assessments, being able to go out and meet a patient and family for the first time, and to be able to assess their current needs and what other services need to be involved, and to help plan that.
Let's think about, if somebody said to you, I'm thinking applying for a role at the hospice, what would you say to them? Do you want to take it in turns to go round?
I would say it's an amazing job to do. My colleagues, they're also supportive. It's a really good team. You might think working at a hospice can be very depressing, but it isn't at all. It's a very, we're all upbeat and supportive to each other. There's lots of learning opportunities. It's a great place to work.
Thanks, Lisa. Martin?
Well, I think Lisa said it all there, really. Yeah. I think, absolutely, if you're passionate about palliative care as I am, I think the hospice would be a great place for you, because it's about putting patients and families first, and as we said earlier on, it's about working in your local community as well. And I just think it's, as Lisa said as well, it's a lovely supportive atmosphere, and we can rely on each other for the support that we need. And if you get the opportunity, go for it. You won't look back.
Thanks, Martin.
Okay.
And lastly, Irene, anything to add on to that?
Just agreeing with everybody else said, but it's getting rid of that myth of the H word, the hospice word. It's not just a building. It is everywhere. The hospice is within the building, but is also outside. And we're well supported within the team of all our colleagues. Give us emotional and physical support, because it can be a very demanding role, but we are really, really well supported, and that's what's really important to enable us to carry out the job that we do, amazing job that we do, and we get that through clinical supervision and support from our colleagues and from managers also. And just to say, that's so important to enable us to carry on the job that we do, which is so rewarding.